So, hey everyone, Socialite PT here, Dr. Lola Adeyeye, and I have a special guest, Dr. Nikki Paul, also known as my sister, my big sis. Yes, definitely. So, both physical therapists, amazing. Not normally do you see physical therapy sisters, thus the physical therapy sisters. But we wanted to come on today and to share with y'all a lot of different information about the evolution of physical therapy from then up until now. And so we're so glad that we have our two different experiences to just come together and share that in honor of National Physical Therapy Month. So I'm going to at this time let Dr. Paul talk a little bit about her and where she went to school and just some more background information so y'all know who she is.
Sure. Good afternoon, everybody. I did my undergrad at Texas A&M University, Gig 'em Ags. I had to plug that in there because you know where she went. Anyway, so I graduated in 2006, and then I took a year off and worked in a rehab. And then I did my graduate degree and got my doctorate of physical therapy at Langston University here in Oklahoma. I got a little guest. Hey. And she walked in right and started messing with the phone. I got my doctorate of physical therapy at Langston University, graduating class in 2010. So, what else am I supposed to talk about?
Yeah, no, that was perfect. That was good.
Is that it? Okay.
Yeah. So, hey, socialites, y'all know me. Dr. Lola Adeyeye, once again, I attended the best university for undergrad, the University of Texas at Austin, hook 'em horns. I took some time off as well, and then I attended the University of the Incarnate Word in San Antonio, Texas, and I graduated in 2018. So, new grad PT, but some years under the belt now. So yeah. So from your time in physical therapy school, just getting ready to, thank you, hook 'em horns in the comments. Getting ready to graduate, what were some things that you noticed leaving physical therapy school and entering the workforce? I know you had boards and everything, but what are some things you experienced as a new grad at that time?
So at that time, you could sign up and take the test whenever you wanted to. A lot of my classmates were taking their test as soon as they got their certificate after graduation. So like the third or fourth week in May.
Oh wow!
I, on the other hand, was not in a rush. I moved back home because my last two clinical experiences were in Texas. So I was chilling at the house, and so I didn't take my board exam until September, and I was one of the last people in my class of 15. Yes, 15 people graduated at a time from Langston in September and passed at that time. Most of my classmates did outpatient PT setting. They most of them were inclined to sports med, high school, sorry, athletics and stuff like that. So a lot of people took jobs there. I, on the other hand, wanted to, because of the school I went to, Langston. Their motto for our school was to serve the underserved. So when I graduated, I wanted to serve an underserved population, which in Texas a lot is the rural community. So I took a job about an hour outside of Fort Worth in Bowie, Texas. Of course, they were paying a little bit more, but you were living in Bowie, Texas. I think I was probably the only brown person in that city of 5,000. Yeah. So it was interesting nonetheless, but it was very much needed. It was a very small hospital. There were 3 PTs there at the time. We had 2 PTAs, which both quit. So then it ended up just being 3 PTs working there. And of course, we did outpatient, inpatient, swing bed. It had about 15 beds in the hospital. And hi, I'm so sorry. and and then home health. I was introduced to home health, which is not anything I wanted to do because I was like, I don't want to be alone in anybody's house, especially in Bowie, Texas, and working with patients. And it ended up being a very good experience. And I actually enjoyed home health more than any of the other places out of all the settings. So
that's really good. From your experience after graduating, you had that. So two things. One, at that time, you guys were actually able to take your boards after or anytime afterwards. And you know, and I know as well as other physical therapists, but now that's completely different. There are more regulations now in regards to taking the board exam. And for our followers who are not familiar with physical therapy and how the process works, after you graduate from your physical therapy program, you actually have to sit for board exams. Some programs in your last year, they will allow you, if you get certain scores on exit exams, to actually sit and take your boards before you graduate in that spring semester. But most programs want you to wait till you graduate, have that time in that summer traditionally, and then take your boards in that July. But most exams you have now, COVID makes everything different, so definitely testing has changed. But most of the time you have the test in January, and then again in the summer, and again in the fall around October time. So, so when I graduated, I actually registered to take my boards in the following. So I graduated in May and walked, and then I took my boards exams in July, and then found out that I passed. So for I think Dr. Paul had the opportunity to. We have guests who want to be in on the live.
Go, Daddy's got chocolate. Go.
So when we, so a lot of me and my classmates, when we were graduating from physical therapy school, I was just trying to find different opportunities. A lot of, similar to your classmates, went into outpatient ortho, like myself. A lot of other classmates went into acute care, but we did have a handful who actually did go into home health. So for your experience, it was nice because, you know, that's not common for a new grad to be able to be exposed to acute, outpatient, home health, all with one job. You normally either apply and you're working for a home health company or you're working for an ortho company. And so that's a little different. So yeah, so definitely for my experience as well, I decided to go more the education route till I couldn't get any more. And so I actually decided to do a residency after I passed my boards in outpatient orthopedics. So that's kind of the route I went and now doing my fellowship. And also, a lot of people don't know that traditionally, a lot of people think you have to do your fellowship or residency right after you graduate. But with physical therapy, you actually don't have to do that. You can get experience in different fields even, and then decide at a later time that you want to go ahead and do a residency or do a fellowship in a different specialty. So very nice. That's
also, don't you, some of the programs when you apply, you have to have some experience. No.
Well, yeah. So some programs now, before you could kind of do a fast way to do a fellowship, but now with the different rules and regulations, you actually have to sit through a residency program to even be qualified to sit for a fellowship. So my graduating class in 2018 was around the last class who can actually finish boards and go straight into a fellowship program. Now you do have to do a residency to even be considered to do any kind of fellowship program. But yeah, but even talking about education piece, when you were applying, waiting during that time frame, working, deciding about going to physical therapy school, what were some things you noticed in regards to master programs versus doctorate programs? Because you were kind of right in that transition to physical therapy schools, going from master's to doctorate programs.
Right. So when I was graduating from A&M, PT school was crazy competitive. What it looked like at the time was people who didn't get into medical school for whatever reason applied to PA school. If they didn't get into PA school, they applied to PT school. So you had people with very high GPAs, you know, super competitive in their sciences, you know, applying and getting into PT school.
Definitely.
So most every school in Texas was a master's program at the time, except for one in San Antonio that had to be in the military, which I was not trying to do that at the time. Still not trying to do that. But the closest one at the time was Langston University to where we live in Fort Worth. They otherwise though on the East Coast, West Coast, even Oklahoma had a doctorate program at the time. I think TWU got theirs 2 years later, and OU, their first graduating class I think was 2011, the year after mine.
Oh wow!
I might be wrong, but so it wasn't. Sorry, it wasn't. Ariana, stop. Go find Daddy. Go find Daddy quick. Go find Daddy. So it was. So it was very competitive. Most people didn't get in on their first try. Most people had to apply 2 or 3 times before they got into PT school. And for me, taking that year off, I just wasn't ready to do that. I wasn't ready to put all that money, and I didn't have, my GPA wasn't the best, especially in my sciences. So I decided to take that year off, retake a few classes, and look into doctorate programs out of state rather than get a master's. There's nothing wrong with getting a master's, really.
Yeah,
but definitely. At the time, with the times changing, it was like, why do that when I can get a doctorate in the exact same time? I think it was maybe a semester more or summer more, but PT schools at the time were 3 years anyway. So it was like, what's the point of doing that? Because a transitional book. Sorry. Not always good at
this is what it looks like
today.
A physical therapist and mother.
Always on your toes. But yeah, so yeah, I wasn't wanting to do that, and I was willing to go out of state. I applied to schools in Boston, one in New York, Langston, because our uncle, our church uncle, owned a PT practice, and he had somebody who went there and was like, you need to really look into this school. And I was like, I had never heard of Langston University. And it's an HBU, and I just never heard of it. And so it was really cool that I was able to get in there. So yeah, I never applied to a Texas school. And I didn't get into Boston. I think it was MIG or MGI, something like that. It was a long time ago. I've had 3 kids since then. I don't remember much. But yeah, super competitive. It was really hard to get in.
Yeah.
How about you?
So for me, completely different story, right? So at that time, you know, you guys were, like you said, there weren't that many physical therapy schools that actually were doctorate programs. So now now that you have more physical therapy schools now, especially in Texas. There are a handful of physical therapy schools in Texas, as well as nationwide. And then you also have your handful of now private schools as well who have physical therapy programs. And then on top of that, same competitiveness. Class size is a little bit bigger with more demand, more people wanting to go to physical therapy school. And just, I think a part of that too is just the awareness. People know what physical therapy is now a little bit more, if you've been exposed to it. And then, so when I applied, it was just looking at doctorate programs. And most of the time, if there was any kind of question, it was doctorate programs who were waiting for that accreditation to say that, okay, hey, we're officially doctorate programs who are accredited. They had just recently still changed. So it wasn't too long ago. I was applying for physical therapy school. For the physical therapy school I attended in what was that 2014, 2015 cycle started in 2015. So even during that time, a lot of programs are still waiting to just be finalized in accreditation for doctorate programs. So a lot of people don't know, like physical therapy is still relatively a new profession that's continuously developing as well. So yeah, so that was the biggest challenge, just knowing like, hey, there's a new route if you want to be a doctor in some health profession, physical therapy's it, and now we have a more influx of applicants who are just interested in getting in some kind of health profession setting. So yeah, definitely now very competitive, and definitely a lot of students find themselves having to apply 1-2 times just to get into school. So I don't think it's uncommon.
There's not a lot of difference between the degrees when you look at it.
Exactly.
Because the research component was there. I mean, we were still learning evidence-based medicine in master's programs. So it's just a part of, I mean, that extra semester is really just to do a research proposal.
Your capstone or whatever it's called at your program. So a lot so now a lot of times if you guys do go to a physical therapist, you might notice that difference in their credentials. So if you see a PT, most of the time, just PT by itself, most of the time that is a physical therapist who got a master's. If you notice too, sometimes that PT, DPT, that individual went through a doctorate program or they went through a transitional doctorate program. A lot of individuals get their masters who have their masters, and now they go ahead and do that extra education to go ahead and get their doctorate. Yeah. Yeah, so that's crazy because I mean the time frame from when you graduated to when I started, I mean it's not that big of like, it's not 10 years or 12 years, and already those many changes happen. So yeah. A quick tidbit, hey everyone who's joined in on the conversation. Good to see you guys. Again, you have the physical therapy sisters here, Social Life PT, also known as Dr. Lola Adeyeye, and Dr. Nikki Paul in the house. So we're just talking a little bit about the differences between the time frame of us going to physical therapy school, what the application process looked like, as well as being new grads and exiting, what our job opportunities were, and also different things that the profession was really trying to encourage new grads to go through and opportunities. Now, just a little bit more so in regards to community perception, working as a new grad and coming into a patient's room and saying, hi, I'm Dr. Paul, or hi, I'm Nikki, I'm your physical therapist. What were your patients thinking that you were coming into the room doing, or what was their perception about physical therapy was?
I don't know if it's everybody. I got a lot of questions about my education because I didn't, most of the time when I introduced myself, I was just like, hi, I'm Nikki, I'm your physical therapist. Yeah. And a lot of times they were like, what makes you qualified to do that? And I was like, well, I actually have my doctorate. And like, oh, you're a doctor.
Let's
go. So I do know what I'm doing. Especially going to a rural place, they don't trust people that don't look like them as much. So I felt like a lot of times I did have to, drop that, DPT bomb is what I would call it, and let them know, like, I know it's good for you. I do know what I'm doing. And just try me out and see. If you don't like it, we have other therapists, that maybe you'd be more comfortable with.
Yes.
But exactly. So it was interesting. I think a lot of people also, after working with another therapist and then working with me, saw the difference in care a lot of times, because my biggest thing coming into the profession, thing that I wanted to change, was listening to people. Because I feel like a lot of times people get so busy, they don't hear what the patient's concerns are. So I feel like for me to be the best, most successful with that patient is to listen to them and know what their needs are and what they want changed. Because I might be like, oh, your extension's not quite at 0, so you're walking. So they're just like, I just need to be able to get in and out of my car without it hurting. Exactly. And I'm like, oh. So if I can do that, that means more to them than that extra little gimp that they have walking that they don't care about, because they always had a gimp. So stuff like that. Yeah.
Yeah, I feel like what's so important, and I guess why Physical Therapy Month is so amazing, is that we really get to stress just what we are as a profession. A lot of times when you say PT, people think, oh, you're a personal trainer, or they're like, oh, you just give, especially in ortho, oh, so I'm here for my massage. No. Like, we're here to make it work. We are movement experts. We're here to get you, just as Dr. Paul said, back to the function and your goals, like seeing what the patient wants and making sure that we can either get them to that same goal, and even sometimes in regards to physical capacity past that goal, let them know what their body's actually able and capable of doing. So I think that's really important. Same. I'll be asked often, and maybe also because I'm a young, fresh physical therapist, like, oh, are you still like an undergrad, like physical therapy? Do you just need a bachelor's for that? And I'm like, oh no, like going to school for like forever. Yes. To get this. And I'm like, oh yeah, like, no, I'm actually a doctor. So a lot of people still don't know it's a doctorate program, and you have to go through all that schooling. Exactly. So in my setting, definitely people come in and with outpatient orthopedics, and a lot of times they've had experience in the past when they might have had a total knee replacement or something, and they're just so used to being put on machines, just getting like modalities or ice, heat, things in that nature. And so they don't really know that we're here as a manual therapist. I'm here, I'm going to move it. We're going to move this. We're going to do a lot of manual therapy and see what we can do to get you back to that functional level. So a lot of times people, they'll come in like jeans and and sometimes even heels. Some ladies will come to PT in heels, okay? And not know that they're about to work.
No.
Yeah, so it's always that initial evaluation where you really have to get your patients in check and let them know, like, hey, this is what we're going to do, and get them moving. Yeah.
And in the hospital, I know you did a couple of clinical rotations in the hospital, so it was always, well, did my doctor say you could come get me? It's like they're the ones that wrote the order. Yes, they want you out of bed. What? I can't move. Well, I need to go to the bathroom. Well, I can watch you walk to the bathroom. Let's get up, and it's just resistance.
I think another big part too with physical therapy developing as a profession, there are so many specialties within physical therapy. You guys hear Dr. Paul mentioning hospital, as we call it, acute care. I talked about outpatient orthopedics. There's other things too, such as our neurospecialists. I see Udom in the house. What's up, neurospecialist? But also treat vestibular conditions. So I might have a patient come in and their doctor actually referred them to physical therapy because they had some ringing or nystagmus in their or fast movement of their eyes, and that they want them to get treated through physical therapy. And so it's so cool because now we have this opportunity again to educate and show, like, hey, we can do it almost all, if not all. And so
wound care, don't forget wound care. A lot of times they just push that off to nurses. Shout out to King Tola. I don't think he does wound care, but at my hospital, we have a wound care team that will go and do wounds, and there are written orders for us to do wound care as well. I personally am not into wounds, so
that's a little on the other side. I don't think so for me either, but but so definitely a big part of the profession. Coming down to our time, Dr. Paul, what is one thing that you would like people to gain from Physical Therapy Month? What's one thing you want people to know about the profession or physical therapy?
I guess the biggest thing is just that we are a huge part of somebody's medical recovery. I think a lot of times we get pushed on the backside, like, oh, you're fine. But as far as like anybody having any kind of surgery, any kind of procedure, that we can help you in different stages of that healing, whether it's right out of the hospital bed, whether it's you go home and you need help being able to figure out how to get in and out of your bathtub, versus coming to an outpatient clinic several months later and realizing that you still are having problems with A, B, or C. The PT works in all stages of life. We work with pediatrics, geriatrics, there's aquatics. I mean, there's just so much. So I think just knowing that there's a wide variety, that instead of putting us in a box of they massage me and put hot packs on me. There's a lot more to that. That's not why we went to school for 3 years, to learn how to do massage and do hot packs, but that we are a healing profession, and really we encompass so much. So
yeah, I love that, and I agree with everything you said. I want people to gain more information, just to know that we are a resource out there, and we're everywhere, literally. And now in many states too, you as a population have direct access, and so you don't need to feel like you're limited to going to so many different referral sources. You can come straight to physical therapy in many states to see what's available for you. And it's not just, like Dr. Paul said, in one stage. If you feel like you have an injury coming on, or you feel like you're not performing in different aspects correctly and know something's wrong, seek out your doctor, seek out a physical therapist, see if it's something that could, as an option to help you. And also just in general, like, seeing us, let that be known, like, mentorship is important and real. Having my big sister as a physical therapist was such a great resource for me. Getting through applying for physical therapy school, getting through physical therapy school, representation matters. Seeing someone who looks like you, who can help you through that process, even from in school to graduating, it's important. It's not often y'all see two physical therapists of color who are sisters. So it's hello.
She's such a fine guy.
I just want the opportunity to thank Dr. Paul for everything that she's done for me, and then just also being just big inspiration, not to me, but also just so many other physical therapists in my generation and others coming behind us as well. So thank you so much.
No problem.
Yeah.
I love it. I mean, that's the main reason, right? We got into it because we wanted to help people. And right now, with the climate of the world, like she said, representation matters so much. So it's just so important to don't ever feel limited that you can't do it, or, oh, I don't see somebody like me doing that. That's why you need to do it, because we need
exactly. Yes, definitely. So thank you guys all so much for tuning in. Thank you so much for being more interested in physical therapy. And please feel free to continue to follow in on all the activities of National Physical Therapy Month for the rest of the month of October. And also following all things PT and social at the Socialite PT as well. And DM us if you guys have any more questions about physical therapy.
Please.
All right. Thank you guys for tuning in.
Love you, sis.